This is One-on-One. Steve Adubato coming to you from the Virtual Reality Center at Rowan University. We're pleased to welcome Dr. Warren Goldman, who is Director, Cooper Neurological Institute, Cooper University Healthcare, and also Professor of Neurological Surgery, Cooper Medical School of Rowan University. So good to have you with us. Doctor, this is part of a series of interviews that we're really trying to make research come alive, right? You have been involved in medicine for how long?
40 years.
Why'd you do it? Why'd you make the decision to go in?
Well, I mean, I think I've always wanted to be a physician, and the brain is really the great frontier. I won't say it's the last frontier, but it's a great frontier and a tremendous challenge.
So in that spirit, we're going to be showing some video. Talk to us about what's behind this, right? We see this. This is, in fact, called 3D, right? The 3D body. Explain to us what we're seeing.
Yeah, so the learning, this is really an educational tool. The traditional way to learn about the body is dissection, which is really not a live process. It's not an interactive process. It's probably the most boring course in medical school to dissect a body that's been dead for decades. It has no three-dimensional quality to it. It's not real. The ability to create a three-dimensional, interactive visual using the most modern imaging technology is a tremendous teaching tool. It gives tremendous perspective to the live body for interventions such as surgery. And it gives us an opportunity to develop surgical techniques particularly important for the brain.
Devil's advocate, doctor, how is this different from an MRI?
An MRI is a two-dimensional depiction. So we use MRI to create these tools. So we take MRI and it's put into the computers of the cave, which is tremendously potent, and it can reconstruct in 3D what we see in 2D.
How would it change, because we're about to see this other wearable technology, but before we go to that, how would this impact a diagnosis, a prognosis, and decisions you would make around patient care, about surgery particularly?
Well, this is sort of the beginning, and that is, this is a teaching tool. So students can learn about the anatomy in a much more interactive way. This is an immersive technology, and you can actually go through the body, layer by layer, organ by organ, and get a much better feeling for how things relate to each other. So this is really a teaching tool. The next step is how we can use this to treat, and that is to use these pictures of the pathological process, such as someone with a tumor that may be concealed in the lung or in the brain that you otherwise couldn't perceive.
So, doctor, could we do this? Let's move to this whole question of wearable technology, if we could. And again, I have to remind myself, these are not my cheap sunglasses. This is expensive stuff. This is wearable technology, and we're about to see video, George, if we could. This is video that we're about to see of you wearing this technology, performing surgery.
Brain surgery, yes.
Break it down for us.
Well, for 20 years or so, we have been trying to use images to guide us through surgery and to prepare us for surgery. So the brain is one of those organs that is extremely unique in that you can't manipulate it.
What do you mean?
You can't move structures aside. If you have a deep-seated tumor in the brain, you can't move things that are in its way, in your way, so that you can gain access, which you can do for every single other organ in the body. So you have to have a way of looking into the brain and be able to turn things around before you start so that you can develop a surgical corridor in your mind to be able to get to the target or the tumor without damaging anything.
You keep calling it a corridor. What do you mean by that?
A corridor is a safe access. You can't go through the brain. We tried very much not to go through it because if you go through it, you damage it. So there are ways recognizing where the anatomy is in 3D and being able to manipulate that so that you can work through crevices, what we call sulci, that is fluid spaces as opposed to the actual tissue. So you really have to have a tremendous knowledge of the anatomy that you can't see.
When did you first start using the wearable technology?
The wearable technology we started to develop here at Rowan, once we got into the cave, when recognized you couldn't operate in the cave, we wanted
Tell
to
everyone
bring...
what the cave is. You keep using the term the cave.
Well, this is
the cave.
This is the cave.
That's
This is
just
the cave.
the term for it.
Right.
So you started using this technology a few years ago.
Right. About
What
5
did-
years ago.
What did you see differently? I mean, right off the bat, you've been doing surgery, brain surgery for a while.
Yes. This gives us the immersive feel. That means you can almost go into the brain before you do the operation and plan your surgery. It's tremendous to be able to pre-play such a dangerous and vital function before you do it. So, you know, the brain, there's zero tolerance for mistake. So if there's anything goes wrong, that's it. You pay the price.
This reduces the odds.
This reduces the odds tremendously because you can pre-play it. You can do it in advance and know this is not a safe way to do it.
When you're talking, I'm curious about this, doctor, when you're talking to patients, right, in broadcasting, mistakes happen all the time. We'll say, hey, it's not brain surgery. And I'm realizing we're talking about brain surgery. So we try to, mistakes can happen in broadcasting. We say it's not life and death. You are dealing with life and death. So when you're talking to patients about what you're about to do and the technology you're about to do it, how much do you tell them?
Well, in 2017, disclosure is everything.
Yep. We're taping this at the end of 2017 to disclose. Go ahead.
So that, you know, you have to balance what the patient needs to know in order to give you an informed consent. So you really can't conceal, but you can be compassionate, you can be optimistic. So that's what we have to do. This is a very dangerous thing. This is brain surgery. And we have almost no opportunity for error. But we're experienced, we use the latest technology, and we've done this before, and this should go well.
Last question. What's the greatest professional and personal reward, satisfaction you get out of your work?
I would say giving a person back their life. And this sounds a little melodramatic, but for example, we do seizure surgery. And people that have been having seizures, epileptic seizures all their life and can't do anything, simple as drive a car or have a job. And we do an operation that stops the seizures. And they've been given their life back. I mean, that's about as good as it gets.
It's about as good as it gets. Doctor, I want to thank you for joining us, breaking this down, and more importantly, for helping so many patients with technology, but also with compassion and empathy. Thank you, doctor.
Thank you.
Well done.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by TD Bank, the Russell Berry Foundation, PSE&G, Adler Aphasia Center, the law firm of Gibbons PC, the New Jersey Office of the Insurance Fraud Prosecutor, and by NJM Insurance Group. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.